Welcome to our training on video visits. Today, we will go over some parts of the basic physical examination that can be effectively conducted over video. Many components of the physical examination can be accomplished through simple observation via audio-visual encounters, as these observations constitute the foundation of any physical examination. Telemedicine is well suited for this type of interaction, and the collection of information regarding a patient's physical well-being begins the moment visual or auditory observation of a patient begins. For most clinicians, the process of information gathering has become so habitual they may no longer be aware of it. In addition, many patients are able to perform some parts of the physical exam that involve palpation, such as checking for sinus tenderness or cervical lymphadenopathy. However, translating physical exam skills to the video modality requires strategic and conscious deployment of various components of the physical exam. This awareness allows for recognizing which examination components can be conducted via telemedicine and whether any adjustments to usual technique are needed, recognizing which examination components require an in-person encounter, coaching the patient through physical maneuvers over telemedicine, and documenting telemedicine examination findings. Today, we will present a template for a brief general physical exam that can be adapted to many clinical scenarios as needed. Not all portions of the examination need to be performed for all patients. This overview will review examination techniques of several organ systems. Let's go over some tips and tricks. In order to record vital signs, the patient should have available any home blood pressure cuff, heart rate monitor, oximeter, and a scale. Some visit types would benefit from additional items such as a flashlight or pen and paper. Ideally, the patient is in a well-lit, private room, wearing loose-fitting clothes with adequate space to maneuver and allow for examination. The use of a mobile device, like a smartphone or tablet, can facilitate moving the camera to see different elements of the examination. At times, having a companion for the visit may assist in obtaining optimal images. It may be necessary to instruct the patient when something in their environment needs to be changed, such as turning off the television.
We're just going to get started on our exam, but before we do that, I'm just wondering if you could just turn off the TV. It's just a little hard to hear. Sorry. Great, thank you.
Okay. Let's now see a demonstration of best practices of a physical exam using telemedicine.
Hi, Bud. My name is Lynn. I'm the medical assistant for Dr. Silvatelli. How are you today?
I'm good. Good morning, Lynn.
Good morning. Can I get your full name and date of birth?
Sure. Bud Steicher, January 6, 1945.
Great. I'm going to go through just some preliminary stuff for your telehealth visit.
Okay.
And let's see here. Have your medications changed at all since the last time you were in the office?
No, they haven't, Lynn.
Great.
No.
And your allergies, has anything changed?
Not at all.
Good. All right, and so we're going to go through just some vital signs too.
Okay.
You have a blood pressure cuff at home, correct?
I do.
Great. So I'm going to have you put that right on for me.
All right.
Staff may collect vital signs prior to the encounter with the provider. The patient can count out their heart rate over a set time, and one can observe the respiratory rate. You may not be able to collect every vital sign, depending on what type of equipment the patient has at home. In this encounter, the patient had some home equipment and was able to report his numbers. Any vital signs collected during the encounter should be documented, along with brief notes as to how the vital signs were obtained, if relevant.
Good morning, Ms. Patsy. How are you today?
I'm doing great. How are you?
I am very well. So I appreciate you joining me today. I just wanted to start and just set a few things for our telehealth visit today.
Okay.
And the first is I'd just like to confirm your name and your date of birth.
It's Ellen Patty, 10/19/1974.
Excellent. And as you know, I'm Dr. Salvatelli, right? Mm-hmm. We've seen each other before, so we're kind of familiar with each other.
Yep.
And then can you just confirm for me your location and your phone number in case we get disconnected?
Yep, I'm in my house.
As the provider joins the patient and introductions are made, the provider can observe the patient's environment, manner of speech, level of consciousness, and overall level of distress. It's important to get the patient's actual physical location in case an emergency response is required for a behavioral health or medical emergency. If the patient requires assistance during the examination, be sure to document the relationship of the helper. It is valuable to document your overall impressions of the patient and their environment, and to meet regulatory requirements.
Good afternoon, Saitel. Thank you for joining us today.
Good afternoon, Dr. Salvatelli. My pleasure.
Excellent. So I appreciate you joining because my first patient, Alexandra, does not speak any English, so your assistance in translating will be greatly appreciated.
My pleasure. I can just introduce myself to Alexandra and then hand it back over to you.
That sounds perfect. Why don't I have her join us?
Great.
Okay.
Buenas tardes, Alexandra. Me llamo Saitel, soy un intérprete del hospital.
Buenas tardes.
Buenas tardes. Voy a estar traduciendo todo lo que se diga hoy en la entrevista. Lo voy a interpretar en primera persona y todo se mantiene confidencial.
Sí.
If you'd like to go ahead, Dr. Salvatelli.
Great, thank you. So Alexandra, it's wonderful to see you again. I can see that you have someone joining us today. Can you share with me who this is?
Some encounters with a patient will require the assistance of an interpreter. This is easily accomplished using a video platform. Under most circumstances, family members are not appropriate interpreters. In this case, the provider thanks the daughter for her offer of help, but lets her know that the interpreter will be working with her mother today. Document that an interpreter was used for the encounter.
Excellent, Kieran. So now we're going to move on to the part of the exam where we check a lot of the functions of your face. And the first part is I want to see how your face moves. So I'll ask if you can raise your eyebrows. Great. And then give me a big smile. Very good. Okay. And then I also just want to see if you have any tenderness. So if you can take 2 fingers and I want you to tap along your eyebrows from the center of your face outward and just tell me if you feel any tenderness there.
Yeah, it's good.
Good. And then I'll have you do the same thing underneath, so right along your cheekbones out. Very good. Okay. So now at this point, I'm going to have you get a little bit closer to the camera so that I can see your facial features a little bit better. And I'm going to show you so you're not embarrassed. So I'll have you get nice and close. I am going to look at your eyes now. So the first thing is if I can just have you open your eyes nice and wide. Great. And then close your eyes so I can look at your eyelids. Perfect. And then you can open again. And what I'll do is I just want to see how your eyes move. So if you can keep your head still, I want you to look to the left and then look to the right. Great. Okay. And then if I can have you just hold your lids down just a little bit on the bottom, and I want you to look up. Excellent. Okay.
Some patients can palpate for sinus tenderness or lymphadenopathy. A light is helpful when examining the patient's face, pupils, and mouth. Checking for findings such as blisters around the mouth, mastoid inflammation, or meningismus is readily accomplished. When documenting, indicate when a maneuver was performed by the patient.
Great. So Rachel, what we're going to do now is we're going to test some of your breathing. Okay. And so the first part is I just want to have you just breathe normally. And I know it's a little self-conscious to do that in front of the camera, but if you can try to do so, that would be great.
Okay.
That was great. I'm just looking to see if there's any extra muscles that you're using while you're working, if there's any increased effort for you.
Oh, okay.
So then the other thing I'd like to do is I want to have you take a number of deep breaths. So maybe if you can take 3 deep breaths in a row.
Okay.
Listen carefully for stridor, audible wheezing, and coughing. Observe the patient's work of breathing, and check for use of neck accessory muscles, cyanosis, or clubbing of the fingertips. As you can see, you can educate the patient during the exam by explaining what you're looking for. Standard nomenclature and acronyms should be used in your documentation.
Great, Rob. So what we're going to focus on now is on the cardiovascular system. And the first thing I'm doing is I'm just looking at you just to see what your color is like. And you've got a lot of good color. I don't see that you have any significant pallor or being too pale. What I'd like to do next is to see how well the circulation is to your fingers. And so I just want to show you what we call capillary refill. And then once you can kind of understand what we're looking at, I'll have you show me. So if you can hold your hand so that your fingernails face you. And I'll have you take one hand and just press rather hard on the nail there, and then you let go. And what you'll notice is when you press hard and let go, it's initially pale, and then the color returns. I don't know if you were able to see that.
Yes.
Okay. So now I'm going to have you show me what you're seeing. So if you can hold up your hand to the camera, and I want you to press tight again and then let go.
Observe the patient's overall appearance of perfusion and check for skin pallor. With instruction, most patients can also perform an assessment for capillary refill and extremity edema. This is an example of instructing the patient to position the camera for optimal viewing. Although you cannot listen to the patient's heart sounds with a stethoscope, you can document the patient's appearance and other components of the cardiovascular exam, such as the presence or absence of extremity edema.
Okay, Alexandra, so what we're going to do now is a bit of an abdominal exam. And so the first part, I would just want to confirm with you that you're in a private spot because I am going to have you expose your abdomen. I just want to make sure you're comfortable with that.
Bien, Alexandra, lo que va a seguir ahora es un examen del abdomen, pero primero quiero asegurar que usted se encuentra en un lugar privado donde se va a sentir cómoda exponiendo el abdomen, mostrando el abdomen.
Sí, está bien.
Yeah, it's fine.
Excellent. So what I'll ask you to do is if you can stand up.
Excelente. Primero le voy a pedir que se ponga de pie, por favor.
Great, and we may need to have you adjust the camera, but let's just have you lift up your shirt first and see if we can see what we need to see.
Posiblemente tendrá que ajustar un poco la cámara, pero a ver si nada más levantando el suéter.
Look for obvious distension, scars, or masses. Most patients can perform a rudimentary abdominal exam to check for self-reported tenderness to palpation in all 4 quadrants. Again, indicate when a physical exam maneuver was performed by the patient in your documentation.
Excellent. So Ellen, what we're going to do now is a bit of a neurological exam. So the first is going to be testing a bit of your coordination. So if I can have you hold your hand straight out in front of you.
Oh, this way.
That up, exactly. And then what I'd like you to do is to touch your nose with your index finger. Good. And then can I ask you to do it with your eyes closed?
Sure.
There we go. Good. And then I want to test the coordination in your hands. So if you can hold your hands up so we can see them, and then I'll have you tap as fast as you can. Very good. Okay. And then I'd also like to test how well you can stand up and how your coordination is in terms of walking. And I'm wondering if you have someone who might be able to help us to hold the camera today?
Yeah, I have Crystal, and she's going to bring my rollinator in. And Crystal. Yeah. This is Crystal.
With instruction, most patients can perform most components of a basic neurologic examination, including assessment for pronator drift, finger-to-nose coordination, and rapid alternating movements. Adequate space is needed to assess the patient's gait, and assistance may be necessary. As we saw, this patient benefited from help from her friend. Of the various components of the neurologic exam, the sensory and reflex exams are precluded by video. On the other hand, basic examination of mental status, cranial nerves, motor function, coordination, and gait can be performed with careful patient instruction.
So Kieran, I understand earlier you were telling me that you had a bit of a rash that you wanted me to check out.
Yeah, that's correct. It's right here on my forearm.
Okay, and I remember you telling me that it was sort of bumpy and itchy. I'm wondering if you can just show me it a little bit better. So if you can grab your phone and then just bring it nice and close so that I can see it. Good, and I'm wondering if you can actually just...
Skin exams require good lighting and good camera control on the patient's end. Don't hesitate to give the patients instructions such as move the camera a little to the right. At times, photographs submitted by the patient and sent to the electronic record may provide a better view. Of the characteristics typically documented about a rash, some cannot be determined by video, such as the texture of the lesions and whether or not they're blanching.
So Rachel, what I'd like to do right now is just to examine your elbow because I understand you're having a little discomfort there.
Yeah, it hurts.
Okay, so the first thing is I want you to just pull up your sleeve and then just hold up your elbow so I can just take a look at it. Great. And when I'm looking, I don't see any redness there. I don't see any swelling.
Yeah, no, it hurts on the inside.
On the inside. So what I'll ask you to do is if you can take your hand and just press around the elbow and tell me if there's any particular spot that's uncomfortable.
Yeah, it's right here.
Right there. And tell me, does it feel kind of bony?
Active range of motion of a joint and assessment for obvious deformities in the musculoskeletal system are readily accomplished. In addition, patients can report tenderness to palpation. Make sure to indicate when a physical exam maneuver is performed by the patient. For instance, this patient has reported medial elbow tenderness to self-palpation.
So Rob, I'm just curious, how have you been since we last saw each other? Anything new or different happening for you?
No, I seem to be doing pretty well, I think.
Good, okay. And I'm curious, since we last saw each other, do you feel like you've had any change in how you're feeling emotionally? Do you feel sad or anxious or upset in any way?
Nothing in particular.
A large portion of the assessment of the patient's psychiatric well-being occurs all throughout the interaction. However, after rapport is built, evaluating the patient's suicide and homicide risk via video is appropriate. Most components of the psychiatric exam can be performed via video. There are some components of the examination which cannot be performed over telemedicine. Severe medical acuity or the need for an in-person physical examination may dictate further in-person evaluation. Nevertheless, we hope that this brief video provides you with basic physical examination tools to help you better care for your patients. Thank you for watching.